First, right now we know our healthcare workers are sacrificing a lot, not only to save lives like you and me, but also to keep their families at home safe.
In some cases, that means leaving their families altogether, missing out on precious milestones, even the births of their own children. Here's one family's story of sacrifice and reunion.
Weeks before COVID-19 reared its ugly head in Louisiana, James and Katie Bamber made a plan.
Our game plan was for him to, stay elsewhere so that our family would be protected.
James is an ICU nurse at Ochsner Medical Center in Baton Rouge. With 3 kids at home and Katie pregnant with number 4, he was ready to do anything to keep his family safe. So when infected patients came under his care, he moved out, staying with a sister who's also a healthcare worker. When was the last time you were in the same room with all of your family?
Let's see, March, the beginning of March, so the first week of March.
It's been difficult, on this end of it. Scared for him, scared for, I have my brother and my sister-in-law are also nurses, and they are also working on the front line, so worried for them, but incredibly proud.
When not at work, the Bambers do what they can to stay connected.
We talk multiple times a day. The kids will call him, FaceTime him. He's also been able to come out to the house a couple of times, and we get him on speakerphone, and he stands at the window, and the kids, they know the routine. As soon as his car hits the driveway, they grab their 3 little chairs and they sit at the window so that they can see their daddy.
When it was time for the baby to arrive, James and Katie had a plan for that too.
The plan was for me to not go into the delivery room. I did not want to expose my unborn child or my wife or the labor and delivery staff. It was tough.
Katie gave birth at Ochsner, surrounded by the labor and delivery staff, instead of her husband.
The plan was for me to stay here at my sister's house, but, of course I panicked. I had to be as close as possible to her, so I threw some clothes on, drove to the hospital, and sat in the parking lot, just waiting to get updates.
When it got time for him to come on out, it was like somebody had FaceTime going, somebody had video going, somebody was taking pictures. James was right up in the mix, kind of, via FaceTime.
The staff captured every moment for James, even the first time he laid eyes on his son from afar.
That was the most emotional part for me, I feel like. I can't imagine, I can't imagine, as a mom, when this baby is born, he came to my chest. So I got to immediately touch him and smell him and hold him, and I can't imagine for James, what that was like.
It was kind of like the Lion King almost, is what I thought of at first, but it was great. Just so much relief, so much happiness that everything had gone well.
Both healthy, mom and baby got to go home, but James would have to wait a little longer. Only seeing his newest son through the window outside the home he can't enter until his self-isolation is done.
Tearing up right now just thinking about it.
It's a moment the Bambers have been planning for since the beginning of all of this.
Excited and anxious to get my hands on him. It's been, it'll be close to a month by the time he comes home that we've been able to, be close to him. So they're ready to get their hands on their daddy.
A moment that finally arrived Easter Sunday. James will get a little more than a week at home before heading back to work and back into quarantine. He says the need is just too great right now. And that's a plan his family says they're ready for.
A small sacrifice compared to what the patients and family members dealing with this virus are having to go through.
Look at this one. He's my twin.
Very special thank you to the Bambers for sharing that very special moment with us, and also from all of us at WAFB. If you work in the healthcare industry, no matter your role inside a hospital, clinic, or lab, we want to thank you for all that you do.